Hello everyone, welcome back to the ChemsGuard, and today I'm excited to share my very first video on pharmacology and why it is important and how it's connected to the world of chemistry. So actually, this word pharmacology is derived from two Greek words called pharmakon and logos. So pharmakon meaning a drug or a medicine, and logos means study or science. So we can define pharmacology as a science that helps us to understand how the drug acts in our body and how your body processes it. So for example, if we take paracetamol, like we all know that we take paracetamol if we have a headache or fever. So so what happened when we take that? So actually it reduces our pain. So that is what happen when we take paracetamol. So it reduces pain and our body processes it. So that's what it's mean. And the pharmacology is all about the science of the particular drug interactions in our body. So according to that, we can divide pharmacology into two main branches. So one is pharmacotherapeutics and the other one is toxicology. So what's actually this pharmacotherapeutic means? So pharmacotherapeutic means the usage of drugs every day in medical therapy. So this can be categorized based on two key perspectives, like how the drug affects the body and how the body handles the drug. So these two branches are pharmacodynamics and pharmacokinetics. Pharmacodynamic means what the drug does to the body. And pharmacokinetic means what the body does to the drug. So let's take paracetamol as the example. So it is the common painkiller we used. So what is the pharmacodynamic and the kinetic of it, right? When we take paracetamol, so this drug is reducing pain and fever. So how it reduces pain and fever in our body? So it is done by inhibiting a certain enzyme in our body. So that is actually the pharmacodynamic of that particular drug. So on the other hand, pharmacokinetics explain how paracetamol is absorbed into the bloodstream, because paracetamol cannot means even when we take paracetamol at once we won't relieve our pain, so it takes certain time. So that means paracetamol needed to absorb into the bloodstream, and then only we can it's undergo certain processes, means it's absorbed and then it metabolized in the liver, and the excess of it will excreted through kidneys. So simply that's what happen when we take paracetamol. It means that's what body does to the paracetamol. So that is the pharmacokinetic of this particular drug. So I took this example because it's easy for you guys to understand these two terms means clearly. And now let's discuss about the toxicology. So what is toxicology? So toxicology means it's a study of harmful effects of substances, including drugs, chemicals, or toxins on the body. Like we all know that anything is too much is not good. Same as that, if we take too much of painkillers, like it can cause so many side effects. Like for example, it can cause nausea, vomiting, stomach pain, especially can cause liver damage and allergic reactions. So like that, there are many side effects that can cause due to the overdosing of the paracetamol. So this toxicology help us to understand how such overdose affects the body and how to treat them. So if I ask you guys a question like what actually we must do when paracetamol get becomes overdosing for a person. So what we must do? So the first thing that you should do is, if you have that activated charcoal, you must give it within 1 to 2 hours of ingestion to reduce this drug absorption. And the first thing that you should do is you must take the patient to a hospital. And then in the hospital, they monitor the liver function, and they are accessing the paracetamol level in the blood, and they give an antidote against that. So this antidote, we called it as N-acetylcysteine. So this N-acetylcysteine is used to prevent the liver damaging, um, and it is this antidote is most effective when we given it within 8 hours of ingestion of the particular ingestion of this given within 8 hours of ingestion, so not get overdose to a person. And all right, so that's it for the today's session. Actually, these are just the basics of pharmacology, and I hope this simple introduction is help you to understand what pharmacology and it's all about. And in upcoming videos, let's talk more about different drug actions and much more. So stay tuned with ChemSquad for more exciting pharmacology content.